cheaper and faster to make these masks than it is to replace the healthcare professionals.
The shortage of personal protective equipment for healthcare workers is hitting home. Many nurses and doctors are resorting to reusing masks and relying on homemade versions to get by. 10 News anchor Mary McKenzie is at Sharp Memorial. She spoke with a retired nurse who made a plea on behalf of her colleagues who are right now very much on the front lines of this battle.
The picture she painted already is very dire as we try now globally to play catch up in making these masks that are for those who are and are willing to continue caring for these patients, putting themselves and those patients very much at risk.
They do feel like they're being ignored. Their pleas are being ignored. Doctors, nurses, and their main plea and cry is for equipment.
Specifically, these N95 masks, which are in short supply around the world and were stockpiled by average people as word of the growing crisis started circulating. Kathy, who didn't want us to use her last name, spoke to me from her home in Carlsbad about how many of her colleagues are having to prioritize who they're using these masks on. Now the CDC is asking them to change protocol and to reuse them. They don't feel safe in doing so because it's jeopardizing patients and themselves. And now there are websites popping up with instructions on how to make them out of fabric. We did a story on a teen who's producing them as quickly as she can, donating them to local hospitals. Kathy says they are a last resort, but it's better than nothing. She also expressed real frustration, as many other health professionals have echoed, that it has taken this long for the orders to come down to get companies that manufacture these masks ramped up on production. She and others fear it may be too late. Kathy said one frustration she has is that there's more equipment out there. She asked that we get the word out to dental offices, woodworkers, painters, and construction workers to turn in any N95 masks to local hospitals in hopes that by the time those people are back to work themselves, there will be more masks available for them. They need to get into the hands of these healthcare workers now. We did reach out to the major hospitals here in San Diego to check on their current supply. Sharp and UCSD tell us they will be hosting donation drives starting later this week for anyone who has N95 masks at home. Scripps is getting back to us about their supply. In Birdland, Mary McKenzie, 10 News.